Hello, everyone. My name is Katie Brandt. I am the Director of Caregiver Support Services and Public Relations for the Massachusetts General Hospital Frontal Temporal Disorders Unit. And I'm thrilled to welcome you to the first part of our webinar series, the Care Plan Trifecta, Person-Centered Care Planning for Every Stage of Life with FTD. I'd love to just introduce to the MGH FTD Unit. We are a clinical research program led by our director, Dr. Brad Dickerson, and we're focused on caring for individuals living with frontal temporal disorders. So that includes frontal temporal degeneration, atypical, young onset, and rare forms of Alzheimer's disease and related conditions. Our team is committed to providing the highest quality of care while working tirelessly for a cure for these conditions. You can learn more about our program at ftdboston.org. Okay, so welcome to the webinar series, the Care Plan Trifecta. Today, we're going to talk about person-centered care planning, kind of as an overarching theory. And then we're going to talk about the framework of the Care Plan Trifecta. We're going to talk about some first steps after you receive a diagnosis. We're going to talk about how the Care Plan Trifecta can work for you and your family. And then at the end, I'm going to talk with our amazing manager of caregiver support services and community engagement, Amy Almeida, for a discussion. Now, we would love it if for those of you who are here in the webinar, as questions come up as you're watching the presentation, put those questions in the Q&A function in Zoom. We are looking forward to addressing the questions that you have, as well as incorporating questions that we know come up in the community. And we hope it will be a discussion that will help you, further understand this concept. So I'm going to begin with just this sort of overarching definition. This is actually from the Administration for Community Living. So what is person-centered care planning? You might have heard this term. And I want to also talk about how this webinar is focused on planning for life after an FTD diagnosis. But person-centered care planning can be helpful if you're living with any diagnosis, any chronic condition, if you're managing any serious medical conditions. So person-centered care planning is a process for selecting and organizing the services and supports that an older adult or a person with a disability may need to live in the community. There's a real emphasis on like community, your individual life. It's a process that's directed by the person who receives the support. And you'll notice that in our framework as well. It's really focused on the person with the diagnosis, their care partner, their family, their community. Person-centered care planning helps the person construct and articulate a vision for the future, considering various paths, choices, and also making adjustments along the way. This approach identifies a person's unique strengths, goals, needs, challenges, and also their desired outcomes. The Care Plan Trifecta is a framework to help you develop a person-centered care plan that centers on the person with the diagnosis, their care partner, and community at the center. The Care Plan Trifecta can help you unify health care, right? So medical care, with your own personal values and goals of care. The point of this framework is we're going to give you a structure, but you apply it to your own life, your own values, your own culture, your own family, and make it unique to you. So As you can see, if you look at this graphic that we've designed, we try to keep it simple because the framework is simple. What's complex is likely your life, right? Living life can be busy and complex. And then when you add on a diagnosis or a complex medical condition, things can get really complicated. So we want to keep it simple. The point of the care plan trifecta is to think about the person living with the diagnosis, their care partner and community at the center. And then how can you make connections with important communities? So the first community that you would need to connect with is your medical community. This is where you're going to get an accurate diagnosis and medical care. The next community that you're going to connect with is your home community because we know that all care doesn't happen in the clinic, right? You're going to go home to live your life. And then the third community we want you to connect with is your patient advocacy community. This is where you're going to find access to advocacy opportunities, support groups, education and information, other families who are walking the journey that you're walking after a diagnosis. So this is the Care Plan Trifecta framework. And this webinar series is going to talk about each community as a different module. So today we're going to be focused on the medical community. Why is it important that I'm showing you this very busy, overwhelming slide? Well, it's because that often after a diagnosis, families have to deal with a lot. There's so many things to think about. Sometimes the path to diagnosis starts with a crisis. It starts with a medical event. Oftentimes, there's a big impact to finances. Your professional job may be disrupted. You need to rethink how you're managing your medical care. If your job has been disrupted, maybe now you have to make a new plan for getting your health insurance. You might need to manage your household differently. There's so many different things to think about, and it can feel really overwhelming. So, how do you start organizing? How do you even begin to make a plan? There's something else to consider as well. Oftentimes, I have the opportunity to present to clinicians. And what I say to clinicians is that when you make a diagnosis of frontal temporal dementia, Alzheimer's disease, or a related condition, you're actually making two diagnoses. One of the person living with Alzheimer's or FTD or related condition, and the other is for the care partner, the caregiver. It's important that I'm highlighting that being a caregiver of a loved one living with dementia can actually be a threat to your emotional, physical, and financial well-being. It's important that I mention that there's actual symptoms that can pop up from caregiver stress, like changes in your appetite, weight loss or gain, mental health impacts like feeling hopeless. You could have change in sleep, emotional and physical exhaustion, which can cause you to withdraw from friends and family. We know that caregivers of loved ones living with dementia can have higher rates of depression and anxiety, substance abuse, heart disease, and chronic health conditions related to stress. What we want is to protect the quality of life of both the person living with the diagnosis and the care partner. So, as we talk about the care plan trifecta today, as we talk about person-centered care planning, know that it is critical that this care planning is done not only for the person with the diagnosis, but also the care partner. So, we're back to the medical community. What does this mean? If we're talking about how to make connections with the medical community, what are the things that we're hoping to get? Well, this is step one of your care plan trifecta. It begins with getting an accurate diagnosis. We always say that it can be a difficult road to become diagnosed with FTD, not only because of the things that you experience along the way, but because FTD is a rare form of dementia. It's an atypical form of dementia. So many families experience difficulty obtaining an accurate diagnosis. But obtaining an accurate diagnosis really matters. Number one, when you receive the right diagnosis for your condition with expert medical providers, then you now have a place where you can go to get education and trusted information about your condition. This is critical because when you understand what's happening with yourself or your loved one, it can then open the doorway to talk about what are the right treatment options for this condition? What research opportunities exist based on your diagnosis? So once you have that accurate diagnosis and you've talked about treatment and research opportunities, now you want to start thinking about how can I connect our medical team members? So step one in the medical community part of care planning is to identify and organize. So identify who is part of the medical community. Who do you need to think about when you're thinking about organizing your medical team? As caregiver support professionals in the MGH FTD unit, Amy and I always talk with families about building a deep bench of support. And we want you to have a deep bench related to your medical providers as well. And what's important to know is that everyone needs to be connected and informed about this new important diagnosis in your life. So that likely begins with your primary care physician. You may have received a diagnosis of FTD from a PCP. It could have been that you heard it for the first time, or it was confirmed by a neurologist or a neuropsychologist. Maybe you were referred to a social worker or a mental health clinician. You're likely going to continue to receive dental care. And maybe there are new therapists in your life, like a speech language pathologist, occupational therapist, physical therapist. One thing to really focus on is to remember just because you have this new diagnosis of FTD, it doesn't mean that any other medical conditions are now not to be worried about. So, for example, if you were living with diabetes, if you were dealing with a cancer diagnosis, if you had a chronic cardiac condition, you still need to be connected with those specialty providers, the cardiologist, a urologist, a gynecologist, whoever is part of your overall healthcare needs to be informed about your new diagnosis and organized. I like to talk with families about this idea of frequency of care and why this is important. So when you're making your list of all your providers, you can kind of think of this as like an outward circle. So again, who is at the center, the person living with the diagnosis? And then maybe who's the first person who's providing that daily care? It's often likely the family caregiver. And then we think about, okay, who is interacting with the person with the diagnosis and the family caregiver at the most frequent level? If you are connected with a physical therapist, a mental health provider, someone like that, you may even see them weekly or biweekly. When you think about your primary care physician, you're probably going to pop in and see them if you have an illness or a new issue pops up, but maybe you only check in with them quarterly or once or twice a year. A neurologist will monitor your care after a diagnosis of FTD, and you'd see them likely every 6 or 12 months unless something, came up that was more acute. And then a specialist like your cardiologist or someone else who's monitoring you for an ongoing condition, you might only see them once every year or every 2 years. Why does this matter? Well, let's say you're getting ready for your 6-month follow-up with your neurologist. but you've had an OT who's been coming to your house every week to help you manage activities of daily living. It's important to consult with that care provider who's been seeing you frequently to say, hey, is there anything that you'd like me to bring up as I prepare for this appointment with the specialist, as I prepare for this appointment with the neurologist? I hope that thinking about this frequency of care, connection, and communication starts to lay the foundation for how are we integrating the many different healthcare providers that are going to be part of your medical community. Okay, so we said you're going to identify who is part of your medical community. Now we want to organize them. So this is just a really simple way, just to give you an idea of how would I organize them. Not in any way that's overly complicated or difficult. What you want is to just think about in the simplest form, who are all the medical providers in my or my loved one's life? Literally make a list of those names. What type of clinician are they? How do you contact them? How do they, work with you and your loved one? What are they providing care for? And then like a notes section. This is not only important for you, the care partner, the person living with the diagnosis, because remember that very busy slide about thoughts after diagnosis? You are juggling a lot. And we want to reduce stress and reduce overwhelm by being organized in an easy and simple way. So that's why it's helpful for you. But it's also helpful for your backup plan. So we always talk about that deep bench of support. We want to make sure that every care partner that's caring for a loved one living with a diagnosis has a backup plan. What if you suddenly needed to go into the hospital to receive medical care? You want to make sure that information about how to take care of your loved one, how to connect with your loved one's providers is easily accessible. So don't think of it in any complicated way, but just make a list. Okay. So you've identified who is part of your medical team. You've organized, you've made your list. Now, let's think about connecting. So there are really two things that I want you to think about in this section. The first is to talk with each provider in your medical community about all the members of your care team. And this is the critical step. Identify who should make final decisions about medications and treatment. What we want is to have like a main provider who's sort of the stopgap or the person that you would go to just sort of say, hey, does this seem like a good adjustment? Does this seem like a good change? And I'll give you an example. Excuse me. So many of you know that I am a caregiver for my dad who's living with Alzheimer's. And early in my caregiving journey, I brought dad to see his primary care physician, where he was prescribed a medication to help with anxiety. A few months later, I brought dad to see his neurologist for a follow-up. And when the neurologist asked me to update, like, oh, what are your dad's current medications? And I let him know about this new medication for anxiety. And the neurologist said, Katie, why didn't you talk to me about this? This particular medication has a side effect of memory loss, which, of course, my dad, who was living with Alzheimer's, didn't need additional challenges to his memory. The neurologist then was able to prescribe a medication for anxiety that was a different medication and didn't have this prominent side effect of memory loss. And it really made me feel like while I was trying to do something good for my dad, I had missed a critical step. And that was to communicate with the expert provider for the condition that was really causing so many challenges in our lives, his diagnosis of Alzheimer's disease. So what I think is really helpful is if you talk with all your providers about who everyone is on the team and then identify, hey, if we make any changes or big decisions, we want to run it by, say, Dr. Dickerson, if you're living with a diagnosis of FTD, the treating neurologist. Okay, so That's the first step. Communicate, talk with everyone. The second step, encourage connections. You want to ask each provider specific questions about how they would like to connect. So, this means saying to your primary care physician, what is the best way for me to connect you with the neurologist? So, right? This is your number one question. What's the best way? So they might say, "Oh, just make sure they have our clinic phone number," or it would be great if the nurse in our office was connected with the nurse in the neurologist office. Um, then you want to ask that very specific question. Do I need to sign anything? Do I need to give permission so that you can communicate between each other? If they're in the same healthcare system, likely that will be very easy. If they're in different systems, you want to ask the third question. Do you have access to the notes and medical records from other medical appointments? So all of the electronic healthcare records, the electronic medical records, physicians should be able to access those even if they're outside of the system. Physicians are very good at figuring that out, but you need to remind them that it's important to you. So let's say, for example, you have an appointment coming up with your neurologist, and maybe your loved one had had a couple of infections that were treated by the primary care physicians. You want to make sure that those doctors can see each other's notes. So, three questions. What's the best way to communicate? Do I need to sign something or give permission? Do you have access? And if they don't have access, how can you help facilitate that? Okay, you've identified, you've connected, and now we want to do something really important. We want to talk about planning ahead. By talking about what matters today, we have the opportunity to protect what matters tomorrow. You know, advanced care planning is something that people often think of, well, I'm only going to need to do that when I'm old or at the end of my life. That's not relevant to me today. But actually, there is an amazing opportunity to have a conversation about your values and your goals of care at the earliest stage of a diagnosis, or even before you are diagnosed with a chronic condition or a life-threatening health condition. These are a couple of books. The Conversation, written by Dr. Angelo Volandes, and Being Mortal, written by Atul Gawande. That might just help you start to think about what are the topics that I want to discuss with the people that I love and care about. What are the topics that I want to make sure my loved ones have heard my voice? Why does it matter to talk about these things early? Well, it's really important to talk about them at the earliest stages because with a condition like FTD or Alzheimer's, in the later stages, you might not be able to have a full conversation with your loved one. So, you want to start by talking about what matters. You want to focus on paperwork and planning ahead. And then you want to know that you can adapt and adjust as things change along the way. So, when you think about advanced care planning, you want to think about what topics. Like one topic might be, what type of care do I hope to receive? What are my values around receiving care? So this might look like maybe you would want to say, hey, it would be my preference to stay at home to receive care. I hope that I can be in a memory care facility that's nearby my grandkids so that they can come and visit me more easily. So, talking about what you hope would be possible, what your preference would be, so that the people who are decision makers in your life can strive to do that as much as it's possible. And so that leads to the second thing. Who will be the decision makers in your life? And it's really important that you identify more than one person. Of course, I think most of us have a primary person. It's often a spouse or an adult child, a best friend. who can make those decisions for you if you're unable to make medical decisions. But it's good to also have a backup. What if the primary decision maker in your life happens to be traveling because they're attending an event for another family member? Or what if they themselves have had a medical event and are unable to make the decision for you? You want to have a backup in place. And then goals of care, really talking about what you think would be important to you at end of life, what you hope that other people would make decisions for you about if a critical medical event occurs. The reason why we're talking about advanced care planning when we're talking about the medical community is this is where getting information from your medical providers can really help you have discussions with your family, not only about your values and your goals, but about what is most likely to occur. So, receiving that accurate diagnosis, accessing trusted medical information, connecting with providers about what you think will happen in the future, what types of medical decisions you might need to make, can help you prepare as best as possible. So once you've had those discussions, then you've got some paperwork to complete. Um, these forms can have slightly different titles if you're in different states across the United States, but for the most part, a healthcare proxy form is a form you fill out that designates who can make decisions for you. Power of attorney or durable power of attorney, those are forms that you can fill out where people can make legal and financial decisions for you. And then a MOLST or a POLST form. These are forms that you fill out with a physician, with a primary care physician, a neurologist, a nurse practitioner, or even a hospice care provider. And they stand for medical orders for life-sustaining treatment or physician orders for life-sustaining treatment. And these are things that you may fill out early after a diagnosis or at later stages, and they can change over time. We will talk more about paperwork that you need to complete when we talk about the home community in the Care Plan Trifecta and how you can access experts to help you complete these documents. The conversation, and this is capitalized because we think about the big conversation about advanced care planning, about your values and goals. The conversation is ongoing and understands that goals of care may change over time, supporting adjustments in care planning. So this means that at the beginning, you heard me say a lot of words like preference and hope and wishes. That's because we can't know everything that's going to happen in the future. We can't know how the disease will progress, how symptoms will present, what challenges uh, may be faced by the person with the diagnosis or the care partner. And so it's important to talk about what matters most and then make adjustments based on our situation. Okay. So, what are the key takeaways from the medical community? We want you to identify, connect, and plan ahead. So you want to identify who are my medical team members. Identify what is the most accurate diagnosis. Identify where can I get my trusted information. And then I want you to connect. Connect clinicians with each other. Connect for access to medical records, notes, and information. And I want you to connect with resources for education about the diagnosis, about care planning, and about being a care partner. And then plan ahead. Discuss what matters most. Document your wishes and keep talking. Keep talking with the people you love and keep talking with your medical team. They'll be there to support you at every stage of life. I want to give a thank you to our team in the MGH FTD unit And I want to express gratitude for everyone in our FTD unit community. Every person living with a diagnosis, care partner, community expert that we work with. When we think about the care plan trifecta, what we're really thinking about is planning for the highest quality of life possible. It's a reminder that you're going to be living with a diagnosis and that making new memories of joy, continuing to live your life with love and connection is possible at every stage. Now, I would like to welcome Amy Almeida to join me. Amy?
Hi, Katie.
Hi.
Thanks for that really educational webinar or presentation. And I'm sure that everyone who's watching today or watching in the future when we post this will be, you know, it gives a lot to think about.
I think it does. And, families often will say to me, diagnosis, like, what am I even supposed to do first? And so I think that that's how the care plan trifecta really became a framework for discussing these important issues.
So I have a couple questions. And,
Excellent.
starting, at the beginning, you said, make a list. So, why, what is the importance of making the list and what should this list look like?
Yeah. So, what's really important about making the list of your medical providers is I think that we all forget, uh, like, how many people are actually involved in keeping us healthy. And even when I made the list and you and I were reviewing the slides together, and you said, "Oh, what about dentists?" And I was like, "Yes, that's right. Oral health is part of overall health, right?" And so, really taking that time to think about everyone who is a part of your medical team. And why is it important to talk about, say, a diagnosis of FTD or Alzheimer's with a dentist? Well, maybe with this new diagnosis, with cognitive changes, your oral care, brushing your teeth, flossing, maybe it's not as good. We know that one of the symptoms of FTD can be a real attraction to sugary sweets. So think about just those two things. Okay, I'm eating more sugary sweets and I'm not brushing my teeth as frequently. Those two things are really going to affect your dental health and well-being. And the care plan that the dentist might put in place could be different based on knowing that, hey, this patient is really struggling with some cognitive issues. So instead of making the care plan that they just need to brush their teeth more, maybe the care plan is they need to come in for more frequent dental clinics. Maybe there's a certain hygienist in the office that has experience working with people with dementia or cognitive impairment, and we make sure that the appointments are made with them. Like there's so many ways to think about adjusting care. And if you're willing to be open and talking with everyone about this new diagnosis, it allows providers to treat your whole person, right? Not just the specialty that they're focused on.
Yeah, yeah, we hear a lot of families who do up their loved ones' teeth cleaning from, uh, twice a year to 3 or 4 times a year to help with that. Um, you talk about talking to your loved one's medical providers, but we hear a lot about medical privacy and HIPAA. I didn't think that was allowed to talk to my family member's doctor. How can I communicate with the clinicians?
Oh my gosh, I love it that you're bringing this up because it's one of the biggest barriers because people just think that they can't do it. So, thinking about privacy, confidentiality, it's incredibly important in healthcare, right? That's what many people reference HIPAA, the health information. Oh, I'm not going to remember the whole acronym. Health information protection,
Privacy? Oh,
privacy. Yeah. But think about what HIPAA is really about and what confidentiality is really about. That means that if let's say your loved one's primary care physician, it means that they need to think about what information they are sharing. They can always receive information, right? So you can always go in and talk to your loved one's healthcare provider and say, hey, um, anything ranging from there are some new symptoms that I'm concerned about. You can share information. You can share it directly with the provider during an appointment, or maybe you reach out ahead of time and say, oh, can I have a phone call with the nurse? I have some important information I need to prepare. That's the same for, hey, Dr. Smith, I want to connect you with Dr. Dickerson. Here's the information. What do I need to sign to make this happen? And when we talk about, like, hey, I didn't know that I was allowed to talk to my loved ones' healthcare providers. This is where we move forward in the care plan trifecta and we talk about planning, right? Identifying who can help make medical decisions. When someone is designated as your healthcare proxy, that can help them have more and greater access to your healthcare providers and your medical information, which can really help them be the best advocates for you.
Sometimes it's hard getting through to just one physician. How can I help the clinicians get through to each other? I mean, I just had a situation like this personally where I went in for my annual checkup, and a couple months earlier, I had had a broken toe. And the broken toe, the folks in orthopedics didn't send a message to my PCP. It was only when she was looking through my notes that she saw that I had had this medical event earlier. So, how can I help the clinicians talk to each other?
Yeah, I mean, one of the things that I think is really unexpected when you receive a diagnosis of Alzheimer's or FTD is that you or likely your care partner need to become advocates, right? So you need to get good at advocating for these connections. And sometimes you need to be creative. So think about the ways that you connect with your healthcare provider. Is it by sending a message through your patient gateway or patient portal? So you might send a message to say, hey, heads up, just want to let you know there should be a note about my broken toe from last month that I would like you to review before my upcoming appointment next week. Maybe you don't typically communicate through a patient portal, but you call the office a week before the appointment or a couple days before. It might be hard to get the clinician on the phone, but most doctors' offices have a nurse or another staff member who will take a note or a message that can be conveyed to the provider. So sometimes it's really just about that, like flagging or giving a heads up to say, I want you to look at this. Did you get it? And it can feel exhausting to do that, but it's like a muscle. The more that you do it, the stronger you're going to get. And I think also your providers will start to know you as, oh, here comes Amy. She's going to be an advocate again. I got to pay attention because she'll keep calling until I do.
I think I'm definitely in, some certain offices as that. Um,
Me too.
well, you talked about advanced care planning, and I kind of thought advanced care planning is something that happens when the disease is a bit more advanced, and the person is closer to the end. What is the benefit to doing it earlier in the disease progression?
Yeah. And, I think this is such a sensitive topic for people, or it is a sensitive topic. And you know what? I used to think of it as a sensitive topic, like, oh, we shouldn't talk about what might happen at the end, or we shouldn't talk about what might happen, not even the end, but just later, right? Because that would be upsetting. But what I've learned over time, not only as a family caregiver myself to people I love, but through facilitating support groups, working in the MGH FTD Unit clinic, is that when we talk about these issues early, when we talk about our goals of care before a medical event occurs, before we need that intervention, it allows for greater opportunity for everyone's voice to be heard. Just think practically. We wish that it wasn't the case, but Alzheimer's disease and frontal temporal dementia, those are progressive neurological disorders. So that means that your ability to communicate, to make decisions, to really speak clearly about what your values are over time is going to change. So when you're diagnosed and you're in the early stages, you likely would have the ability to say, well, this would be my preference, this would be my value, this would be my wish. But in the late stage, you might not be able to communicate that. So if you're a person living with a diagnosis, it is important that you talk about how you want your care to look over time. And I think that, you know, what we're talking about here are potential situations. And that's where you need to connect with your medical provider to say, like, what are the things that I should even be thinking about? Because you probably don't know.
It's the phrase that AFTD has, right? If you've seen one case of FTD, you've seen one case of FTD.
Yeah,
Everyone is different.
everyone is different. Yes.
And, you mentioned updating the care plan over time. And, I don't know, I think about some of these documents sort of almost written in stone, to get some of these documents prepared. So, how can the care plan change over time?
Yeah, so like let's think about something that I hear a lot, which is people say, okay, I want to stay at home the whole time and receive care. I would never want to live in a facility. I hear people say this like very strongly. And, something that our family personally has experienced is real love and support from community-based memory care and skilled nursing facilities. And I've seen that happen with many of the patients and families that we have the privilege of caring for in the MGH FTD unit. But let's think about this. Early on, when you receive a diagnosis, maybe, you're able to walk up the stairs to take that shower. You are not having any trouble using the bathroom on your own. You are easily able to eat all of your meals. But later on, maybe you need a lot of help walking. Maybe you yourself, the person with the diagnosis, you're, a tall man, and maybe your primary care partner is a petite woman who would have a lot of physical difficulty meeting your medical needs. And so I think that the reason why we want to be open to this idea of that care planning needs to be adjusted to reflect needs, like not only wishes, but needs, right? So it might be your wish that you would stay home to receive every stage of care, but what if that wasn't safe? What if staying at home meant that all your medical needs wouldn't be met? What if, in fact, there are services and supports that you could receive in a memory care or skilled nursing environment that you don't even know about that could greatly benefit you and your care partner? So I think that it's important to state your wishes and your values, but a value that people also have is wanting to protect their loved ones. A value is that they want quality of life for their entire family. And so I think that the more that we really acknowledge, like, okay, what are the medical needs that I'm experiencing? What's the resources in my home available? What are the abilities that my care partner has? Um, I think that really thinking about all of those things and how they're different at every stage helps you make a plan that can keep moving, keep being adjusted. It's not set in stone at any one point.
Well, that's all the questions I have.
You have great questions, Amy. I love it.
Katie, we did get a question about the slides. And so if anyone would like a copy of the slides today, please email me at aalmeida9@mghharvard.edu. And that's at the in the chat. And be happy to send them out. Um,
I think the other thing is this is recorded and it's going to be posted on our MGH FTD Unit YouTube channel. We want more people to go there because there's a lot of awesome videos and content. So if you go to YouTube and you just put in the search function MGH FTD Unit, we will pop right up. And we'll be posting this recording, within a few days. And I think it's just really important for people to know that we post these resources because we want you to be able to go back over time. We also want you to be able to share these things with others. So let's say you are a spouse caregiver and you want to talk about advanced care planning with your adult children. And maybe your adult kids are like, ugh, Mom, why are you talking about this? This is so awful. We don't need to talk about this now. Well, maybe you send them the link to watch this video. And it helps the other people in your family understand why you might want to talk about these topics early, why it's important and why it's helpful. So we hope that these webinars, um, these educational opportunities really help people just start conversations, think in a bigger way about care planning so that you can then get back to the business of living your life. Just because a diagnosis has come into your life doesn't mean you stop living, doesn't mean you stop making new memories of joy. We really believe that.
Thank you, Katie. And thank you, everyone who's attended today.
Thank you all for attending the first part of our Care Plan Trifecta webinar series. Look out for our next module, which will be coming soon, where we're going to talk about the home community. Thank you all for attending today. Take care and be well.